So hello guys, today we are going to study about another group of antibiotic which is cephalosporin. So as we all know, cephalosporin is divided into four generations. So the first generation of cephalosporin has mostly gram positive coverage. So it mostly covers gram positive organism. With successive generation, there is increased coverage of gram-negative organism. So successive generation have this increased gram-negative coverage. So first generation is for the gram-positive, and with successive generation, there is increased coverage of gram-negative. So let's talk about first generation cephalosporin. So the example of first generation cephalosporin are cefazolin and cefalexin. Cefazolin and Cephalosporin. So it was developed to treat Staphylococcus aureus resistance to penicillin. So it is mostly main use of this first generation cephalosporin is in the surgical wound. Surgical wound, that is skin infection, and the cefazolin is also sometimes given for pre-op prevention. So this is about the first generation cephalosporin. So let's move on to second generation. Some example of second generation are cefuroxime, cefoxitin, cefotenin. So it has more coverage of gram-negative organism, more coverage for gram-negative organism, as we have already discussed. So it covers gram-negative organisms like as influenza, Enterobacter, Proteus, E. coli, Klebsiella, Neisseria gonorrhea. So it has also some anaerobic coverage. So let's move on to individual one. Cefuroxime oral is used to treat otitis media as it covers Staphylococcus pneumoniae as influenza, and used to treat UTI in children as E. coli. It covers E. coli. So let's move on to third generation cephalosporin. So the example of third generation cephalosporin is ceftriaxone, which is most commonly used, cefotaxime, and ceftazidime. So it has more gram-negative coverage, and it has also more resistance to. These are also more resistant to beta lactam enzyme. So the chance of resistance is less with successive generation of cephalosporin. So the two drugs ceftriaxone and cefotaxime of third generation has poor coverage for pseudomonas, but but uh, cefi- but ceftazidime covers pseudomonas as well. It covers pseudomonas. So it is used in hospitalized patient. So this antibiotic is used in hospitalized patients to treat pneumonia. This is also used to treat pneumonia, sepsis, and is also used in meningitis because it has more it has good CSF penetration. So let's move on to ceftriaxone. So ceftriaxone is commonly used for gonorrhea. So we all know that. So it is used to treat Neisseria gonorrhea infection, and is also used in meningitis as it is active against Staphylococcus aureus meningitis and it has good CSF penetration. So let's move on to another fourth generation cephalosporin, which is cefepime. It is used. It covers gram negative, gram positive organism as well as pseudomonas. So it is used in some resistant cases and in hospitalized patients. Sense. So let's move on to the. I think many of you don't know about the fifth generation cephalosporin. It was approved in 2010. It is a newly approved drug. So many of us will not be knowing about it. It is newly approved in 2010. It is called safe safe ceftriaxone. So it is newly approved drug, and it binds. It covers both MRSA, some gram negative organism, and it is studied in skin infection and pneumonia. So you just need to know the name, which is ceftriaxone. So let's move on to mechanism of action of cephalosporin. The mechanism of action is similar to penicillin. It binds to the transpeptidase penicillin binding protein enzyme and it alters the membrane. It binds to aniline residues and alters the enters the genetic makeup and it causes autolysis. So the mechanism of action is similar to penicillin. Let's move on to adverse effect. So the most common adverse effect is hypersensitivity reaction. Hypersensitivity reaction. It causes anaphylaxis. It causes rash, maculopapular rash. It causes fever, arthritis. It also causes hemolytic anemia. It causes nephritis and Stevens-Johnson syndrome and toxic epidermal necrolysis. So these are the hypersensitivity reaction uh, of cephalosporin. Another side effect is it causes vitamin K deficiency. So before learning this, let's study a little bit about vitamin K. So there are two types of vitamin K: vitamin K1 and vitamin K2. Vitamin K1 is obtained from diet from green leafy vegetables, and vitamin K2 is produced by GI bacteria. So the vitamin K2 is produced by the bacteria of our GI tract. So antibiotic, it reduces the while using this antibiotic, it reduces the production. It reduces bacterial vitamin K, that is vitamin K2, because it this vitamin kills the bacteria. As a result, vitamin K is produced in lesser amount. So due to less production of vitamin K, there is increased INR and there is risk of potential bleeding. So it is cautiously used in patients who are taking warfarin. So patient taking warfarin plus this antibiotic cephalosporin, there is increased chance of bleeding. So they are most commonly not used together. If used, then INR is monitored and the patient is monitored, and it is this both drugs are used together. So, and another side effect of this generation cephalosporin is hypoproteinemia. So mostly cephothitin and cefazolin has this kind of side effect. It inhibits the epoxide reductase enzyme. It inhibits epoxide reductase. Another drug also inhibit epoxide reductase. We have studied